Someone who's diagnosed with Alzheimer's disease, at the early stage, that person starts to have some kind of memory loss. They have some kind of behavioral issues, right? At the very early stage. And that's why, as this show is for people with who it's covering, this podcast itself covering mental illness. If you are living with somebody and you see that person start to have those kind of memory loss, do not wait until it's getting worse. Just see a professional to talk to them about this kind. If you see some behavior that you haven't seen previously in that individual, just go to a professional to find out, because it can get to the main stage. At that point, the person will not only have this kind of memory loss, but there are some cognitive behavior that will happen, right? So you may be coming here as a friend of mine, and I may not even know that's Dr. Hippolyte, because I just have this kind of blockage, just kind of blurred in my memory, and I cannot recognize it. At that time, when I get to the stage, that means the disease is very progressed, right? My cognitive functions start to get, I start to lose that cognitive function.
So you will consider that it is so mid stage, not the severe stage.
No, the severe stage, the late stage of the Alzheimer's disease, it's when you totally forget things. You cannot remember. If you have your pen, you put it right there, you don't remember where you put the pen. You just have it a few minutes ago, you don't remember where it is. You do not remember your family. Your health starts to decline, right? You cannot even take care of yourself. That's the late stage of the disease. So you totally depend on either family members or somebody else to come to take care of you. So at that time, the disease is really in the very progress stage. That's the severe stage of Alzheimer's disease. And at that time, you really, unfortunately, depend on somebody else to help you.
So the first stage, like what you will call the mild stage, is the stage that, anybody around you should really pay attention to any changes that may occur.
At any stage, you should pay attention to the individual who's diagnosed with Alzheimer's at any stage. However, earlier you catch those kind of symptoms, better it is. Although there is no cure, I have to tell you this, there's no cure for Alzheimer's disease. Because you catch it, that doesn't mean you will visit your professional and they will cure it, but they will put you in a situation where they can do some kind of therapy with you that can help you. But if you ignore those signs, those early signs, you ignore them, the consequences will be even worse. So that's why whenever you catch them, it's important that you go see a professional. They know what to do, because let me just tell you a little bit. I have to go a little bit in depth with this. I didn't want to tell you more about it. What do they see professionally? What do they see, the scientists, what they discover? And that's the same thing. That's the same thing Dr. Alois Alzheimer's he discovered in 1906 when that lady of 51 years old visited him. He saw some plaques that were accumulating in the brain of the patients, right? Because when you see those plaques,
can be at any side of the brain, or is there
it's specifically in your hippocampus.
Okay.
It's specifically in your hippocampus. They see, your brain is divided into several regions, and when they saw those plaques, and literally all the neurodegenerative disorders, they have to do with your brain. And when he saw those plaques, they call them, in a very technical words, beta amyloid plaques. And also they noticed there are one type of protein, they call it the tau protein, Tau, that like tangles into different regions of the brains. So when they saw that, it's abnormal. Those are abnormal stuff. So, and those abnormalities, they are the result of some mutations. Right? They are the results of mutations, because those proteins they saw, they are the result of different protein that were mutated, that were responsible for the well functions of the brain. And when they mutate, the protein cannot fold properly. I'm sorry, I'm getting into some technical words, but it's important for everybody who is watching the show so that they can understand. And the mutations cause those proteins not to be folding properly, and now they start to accumulate in your brain. And when they are accumulating in your brain, specifically in your hippocampus, so now you start having those kind of issues, those behavioral issues, those memory loss, because they shouldn't be accumulating.